if you're watching this video, hopefully by now you have done some work on diaphragmatic breathing as well as the connection breath. So the diaphragmatic breathing with the pelvic floor connection, pulling up, creating that tension and finding that connection to those core muscles to engage and wrap around and pull everything in tight here. And I don't mean sucking in, right? But you feel that kind of corset activation of the musculature throughout the entire abdomen when you exhale with that connection breath. So the next component of stabilizing the spine through movement is creating, well, one, tension through the breath, which you did a little bit with the connection breath, and then two, the full bracing component. So the heavier something is, okay, the more you have to brace. And we do it automatically when we go to lift something heavy, right? You go to lift and you're like, hoo, okay, that is us bracing to prepare our bodies to move something heavy and to be strong and safe while doing it. So we want to do that intentionally while we lift. So again, by now, if you feel comfortable with the diaphragmatic breathing, connection breath section, you can do this in a lot of different positions. And I encourage you to try different positions with this technique so that you can get really comfortable when you're lifting and moving through that. So there are a lot of different exercises that will require this. So just practicing it and playing with it, lying down on your back, kneeling on all fours, standing, sitting. You really can't pick any wrong positions to do this in and to get comfortable doing this with. So we're gonna start just on our backs because it is the most simple. So from here, I want you to wrap your hands around kind of your pelvis and low abdomen here. So with the breath, okay, you're gonna take that inhale through the nose, full expansion, 360 degrees diaphragmatic breath. As you exhale, okay, we're gonna go connection breath. We're gonna start to create tension through the exhale, so tongue against the teeth. Now the pelvic floor starts to intentionally engage as we pressurize down, okay? We don't want to just drive down and create pressure down without also pulling up. Okay, so start to exhale, pull up from the pelvic floor. It's gonna feel like you're stopping yourself from peeing. And then from here, okay, this is intra-abdominal pressure, and you should feel that pressure out into your fingers, okay? So that is the connection breath. From that point, okay, going into bracing, which bracing you will use generally about the 70% of your kind of 1 rep max, or at the bottom, kind of a quarter of any kind of bottom or top rate of any kind of lift. Okay, so for example, for a squat, if you're going down the bottom quarter of that, okay, the lowest point, you might hold that breath for like a second or two, okay? As you start to drive up out of it, you're gonna start to exhale and create that tension. If you're above your 70% 1 rep max, you might hold your breath for the entire time to stay braced, okay? So that is dependent on your experience, your weight, all that. But as a beginner, okay, or someone who's, again, not lifting, 70+% of your maxes, you're going to use the breathing component. However, we're gonna practice that bracing so that you get comfortable with it and you can use it, again, in the bottom quarter or hardest part of the lifts. So you're going to take that belly breath in, expand, start to push the air out, and then you're going to stop it. So you're going to not let any more air out. You're going to pack it down into the low abdomen, and you should be able to kind of press into the front of this the pelvis here and feel that tension outward, okay, as you then pull up on the pelvic floor. So again, we're not putting pressure downward without also pulling up. We don't want to just like drive that out. So pressure down, pull up. We should feel really stable, really strong all around the sides, front, okay, low core here, and then relax out. So you're only gonna hold it for like 1 to 2 seconds. Feel it, engage, okay, make sure you have that connection, and then completely relax. So let's do that again. You're gonna take that diaphragmatic breath in, 360 degrees, tension, exhale, connection breath. As you start to exhale, start to pull up on the pelvic floor, stop the air from coming out and pack it down low. Feel tension. 1, 2. Relax all the way down. We're gonna do a couple more here. So breath in, 360 degrees, expansion. Start to exhale, stop it, pack it down, pull up, engage, pelvic floor, and relax. We'll go one more here. However, you're gonna do that's 1 rep a piece, so you're gonna do as many as it is designated on your workout. So breath in, 360 expansion, start to exhale, stop it, pack it down, find that tension, pelvic floor pulls up, and relax.
So to put that bracing, breathing, intra-abdominal pressure component together with movement, okay, I always want you to think exhale on the effort. And when I say exhale, I mean by creating tension, okay, so with intention of stabilizing here and generating more power. So describing the squat again, so as you come down, okay, you're breathing in, again, expanding here, and it can help if you put your hands here, right, as you do your squat. So find that low core, you're breathing in, right, you might brace, 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 exhale out. Breath in, brace, brace, okay, remember, brace, that pressurizing down, engaging the pelvic floor. Brace, 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 exhale on the way up. Okay, so same with the push-up. As you come down, breathing in, exhale out. Breathe in as you come down, brace, brace, brace at the bottom, exhale on the way out. So always thinking about exhale on the effort, unless again, you're above that 70% mark, in which case you might find that you need, to brace and create tension throughout the entirety of having whatever the weight is on you. So start to use that throughout your movements. And again, think exhale on the effort. So that is your cue in terms of breathing. And then the inhale will obviously be the opposite of that. So start to incorporate that into your movements, even if they're easy, just getting the idea and ingraining that kind of into your brain and your body. Again, using different positioning, while doing different movements can really help just solidify that patterning.